All right, welcome to another edition of Medicine Mondays. I am yours truly, Dr. Pierre, your favorite board certified internist, founder of drbarrypierre.com, and your resident host of Medicine Mondays, the Empower Yourself for Better Health series here on my YouTube channel, as well as Dr. Pierre's Health Checks, which is another YouTube channel that I have, and I'll throw one of those little links above my head so you can make sure you could quickly subscribe to that, where I usually give like 1 minute answers to questions that I get a lot, especially in the medical field, right? So definitely, you should obviously be liked, subscribed, and notified to this page, but I suggest you definitely do the same thing to Dr. Pierre's Health Checks. And if you have any questions, concerns, feel free, leave a comment on that page, right? And I'll make sure I'll make a video answering your question, right? So that's really the goal of that question. Just 1 minute clips. Like I said, I'm not talking long on that page like I do on this page here, which I can do. So today's March 1st, guys. So what we're going to do today is I'm going to give a little bit of a highlight of what's to come for the rest of the month. And most importantly, I'm going to shine a little light on some of the different medical related observances that we do in the month of March, right? Like, again, we just left February. We know February was kind of, the big one that we talk about is kind of National Heart Disease Month, right? Sponsored by the American Heart Association. That's usually the one that gets probably the most fanfare. March is not this. March is just the same, right? So March, we have a lot of different topics and different specialties, which I love to kind of talk about. And the goal, right, like I said, we like to do this kind of cross-matching thing, right? So if you are one of my podcast listeners, which if you aren't, I'm not sure what you're waiting for, right? Again, I am a host of podcast Lunch and Learn with Dr. Barry, where I talk about different medical topics, just like I do here, simplify those medical topics just like I do here, but I also get the chance to bring some amazing guests on there as well, too. So definitely, if you have not had a chance, make sure you head over to whether it's Apple Podcasts, Spotify, where am I at? Google Play, wherever you listen to podcasts. I have my podcast is already iHeartRadio. My podcast is already over there. Make sure you subscribe over there as well too. And if you love it, make sure you leave us a 5-star review. Let us know how we're doing on those outlets. So today we're going to be talking, just give a little bit of a nugget, right? And the reason why is because the rest of this month I'm actually going to be going into full detail on some of these discussions, right? But I definitely wanted to make sure I just kind of gave you a little nugget of what's to come, right? So first and foremost, in March, right, we celebrate colorectal cancer awareness month, right? And it's such a topic, right? Again, obviously Chad Boseman, the former actor, died recently, right? He didn't even get 5 years after diagnosis before passing away, right? So, I know it got a big fanfare, right? And then it kind of died down, right? So we want to make sure that colon cancer is one of those things that never gets pushed to the wayside, right? Reason being, right, it is the third leading cause of cancer related death, right, here in the United States, right? Not only is that, it's the third most common diagnosed cancer, especially among men and women, right? So for those two causes in and of itself, it's such a huge point to kind of scream it from the rooftops, right? Because we want people to be aware, right? And why? It's because we know one of the biggest risk factors associated with colorectal cancer disease is when we catch it, right? Unfortunately, in Mr. Boseman's case, right, it was obviously caught late because we know that in stage one of colon cancer has a 90% survival rate. Right. Let me say this again. 90% survival rate. Right. So we know it was likely caught late. And I don't want you to be watching this channel, following me on the blog, listen to my podcast, right, and not being up to date on, especially with this cancer. Right. It's one of those things that we need to be very wary of. Right. So colorectal cancer awareness month is this month. Look for more detailed video as well as an episode on the podcast. National Kidney Disease Month is also here. 1 in 7 people have chronic kidney disease here in the United States. And let me show you an even more sombering fact, right? 9 in 10 people who have chronic kidney disease don't even know it, right? And think about that, right? 9 in 10 people who have the disease don't even know it, right? And if they don't know it, guess what they can't do? They can't treat it, right? They can't prevent the progression of it, right? It's nothing's more disheartening, right, for me as a hospital physician when someone comes into my office, right? I'm saying someone comes into the hospital. I'm getting a flashback when I did outpatient medicine. But I'm gonna give a little story. When someone comes into the hospital and they walk in, right, with essentially kidney failure, And then all of a sudden, what they thought was, I'm having trouble urinate is like, no, your kidneys are shutting down. You need to go on dialysis, right? That's a totally different discussion, right? And which could be prevented, right? And there's a lot of different causes for it. Like I said, check, definitely pay attention to the podcast. We would definitely make sure we drop a podcast episode. And I'm actually working on getting a special guest for that as well, too. So I'm gonna keep it quiet because it's not confirmed yet. Again, National Kidney Month also in March. National Nutrition Month, right? Again, this is how we will help to learn and make informed food choices as well as develop healthy eating habits, right? That's the goal of National Nutrition Month. Again, and I've actually had Dr. Lauren Powell, right, on the podcast, as well as I had actually a registered dietitian on the podcast as well, too, right? Really trying to give us tips on how to eat healthy and live healthy and eat better for ourselves, right? So definitely National Nutrition Month. Again, I'm going to be posting on my social media platforms. If you don't follow me, make sure, again, you'll see at the end of the screen all of my social media platforms. But essentially, it's Dr. Barry Pierre at wherever, whether it's Twitter, whether it's Instagram, whether it's Facebook. Dr. Barry Pierre, you're likely going to find me there. World Tuberculosis Day, right, is also very important, right? And reason why, and obviously, COVID-19 is the flavor of the year right now, right? And when we talk about infectious related disease, HIV definitely has not gone nowhere. Tuberculosis has also not gone nowhere, right? Tuberculosis, right, as we speak, is one of the top 10 causes of death worldwide due to a single infectious agent. Again, COVID's up there, HIV's up there, tuberculosis is right there, right? So we spend the day just kind of recognizing, acknowledging like, hey, this is still a problem, right? And because we acknowledge it, right, and because we're aware of it, we know how to protect ourselves from it. And Save Your Vision Month, right? Like this was actually a one that kind of like, I was like, oh, that's interesting, right? Because I didn't know. But like, look at this number. Over 12 million people over the age of 40 have some type of vision impairment. Again, welcome to the club, guys. Like I've had glasses since, in fact, I'll give you my story, right? My glasses story. I was a resident. I was a second-year medical resident, in training, doing what I do. And I remember sitting in the back, and then, one of my co-residents wrote something on the board, and I couldn't see it. And I was like, and here I am, right? So I'm a resident. So I'm like, I'm not older than like, let me see, 27, like 29 or something like that, right? So I'm not even 30 yet, right? But here I am squinting at the board, and I'm like, why am I squinting? Like, what is happening right here? And lo and behold, I had never got, I never had an eye exam, never got tested, because I was like one of these people, right? I didn't think I needed to get my eyes tested. No one in my family had glasses, right? But now I think about it, they probably should have, right? But I was like, oh, whatever. So I ended up going to an optometrist, and lo and behold, hey, they're like, hey, yeah, you need some glasses, right? So it was definitely one of those kind of eye-opening things for me, right? So again, so this is definitely one that I'm like very keen on, right? Save Your Vision Month, right? Because if over 12 million people over the age of 40 have some visual impairment, right? Like, if you would want to know if there's certain things that you can do now to try to prevent it. If you ask me, I blame all of the late night studying and reading that probably, got me to where I'm at, right? If you had to ask me, but whatever, I'm not gonna, I'm okay with that. I've gone to where I've gone to, and I definitely want to give my quick backstory on the National Kidney Month. Like as a outpatient doctor, I remember taking care of this. The patient new patient comes in. And, they just wanted to kind of a wellness visit, right? They're like, hey, doc, I haven't been to a doctor in a while. My wife told me to come to the hospital. My wife told me to come to your office to come see you. Cool, right? And had been on no medications, right? Because they've been avoiding the doctors, right? So here I go. I said, oh, yeah, let's just do kind of our routine checkup. We always check the kidney function, check your liver, check your kidneys, check your diabetes, check your, all these things that we typically do on your wellness visit. And, when I tell you, right, when I got those lab results back, right, the state of shock that I was in, because this was a healthy, fit looking gentleman. And next thing you know, I'm having to tell him like, hey, like, not only are you like a really bad diabetic, but you're about to go on dialysis, right? Like I had to tell, like, and the person was only 40 years old, and his kidney function was that bad, but he didn't realize it. And he never, I love this analogy, right? Because a lot of times, especially, I'm on social media a lot, where, people will make fun of people who are obese, right? Or, chastise people who are obese because they must be quote unquote unhealthy, right? Just because they're obese. Like, that's literally the only thing that they see. And they say, oh, this person must be unhealthy because they're obese. And here was this fit 40-year-old gentleman, works out every day, at least probably like 3 times a week, most likely. And I had to tell him, like, your diabetes is trash, and your diabetes is severely uncontrolled, right? And you about to go dialysis if we don't do something about this, right? So I never judge people by the physical appearance, and look, those are the reasons why, right? So I always caution those people, especially when I see them online, assuming that because a person happens to be obese, they're also severely unhealthy as well too, because those would be the same people that would downplay a person like, my gentleman that I was taking care of because he was fit and he went to the gym, as not just because this guy was just as sick, for that standpoint there. So again, just one of those things. Like I said, we are going to be touching on a lot. Like I said, we're not going to have full blown episodes on all of them, right? But we are going to be touching on some of them, kind of throughout the month. Like, we'll definitely touch on colorectal cancer. We'll definitely touch on national kidney disease. For sure, right? And I'm trying to figure out which ones I want to do another Medicine Mondays. Again, if you, right, especially the ones you just kind of heard me discuss, right? If you have one that you may be interested in more than another, make sure you drop it in the comments, right? Drop it in the comments, because again, you guys are the viewers, right, of this channel, right? So you guys will tell me what you want to watch, or what you want to hear from yours truly. But like I said, if you happen to be one of my podcast listeners, we're going to touch on some topics over there on the podcast side as well, which I'm very excited for. And again, I always say this before, not that I want to, disregard what's going on the side of, the other observances, right? Because again, I say, some months you have one disease that takes up the whole month, right? AKA October, AKA breast cancer, right? But there's a lot of other things that happen during October, right? So like, I'm just going to show you this page again. This is on the national, Health Finder, right? For healthfinder.gov, right? Just kind of and just so you can kind of see what other things that are observed this month as well, just so you guys can get an idea of all the things that we typically look at, right? Especially because again, those, colorectal cancer, national kidney issues, right? Vision, right? Nutrition, they may not affect you, right? But maybe one of these things may, or have someone that affects you in your family that you may kind of notice, right? So let's take a look at this page over here, just so we can kind of focus on, what other things are happening this month that I probably won't be touching, but you may want to know. Like, so as you can see here, again, some of these are like, wow, that's interesting. Like Bleeding Disorders Awareness Month. Apparently this is National Cheerleader Safety Month. We talked about the colorectal cancer. National Endometriosis Awareness Month. We had a couple great podcast episodes about endometriosis and infertility. I suggest you definitely check that out. Problem Gambling Awareness Month. Trisomy Awareness Month. Workplace Eye Wellness Month. Again, that kind of goes along the same lines with the Save Your Vision. National School Breakfast Week, Patient Safety Awareness Week, Brain Awareness Week, right? Like, as you can see, there's a lot of things that occur. National Native American HIV Awareness Day, American Diabetes Alert Day, right? So a lot of things that are happening, this month that, again, we can highlight, right? But I want to make sure that, we're not, brushing it over, right? And making sure that everyone's getting their fanfare. So again, like I said, I'm yours truly, Dr. Barry Pierre, your host of Medicine Mondays, right? And make sure, like, subscribe, notify, so you'll be aware of what's going on the channel. And I do want to kind of give you a kind of, I guess, a new news, right? So I've been talking to a few of my followers, especially on the kind of social media platforms, right? As far as they love the Medicine Mondays, right? But they said like, hey, maybe that's not enough, right? So what we are going to be doing, we actually started last week, right? So if you are already a subscriber, you probably already got the notification. So we are going to start doing Livestream Fridays, right? Where I kind of give a highlight live stream video where you can come in and ask your questions if you got some questions. But most importantly, we may talk about something that pops up over throughout the week that I may have missed from Medicine Mondays, right? And last Friday that just went past, we were talking about the Johnson & Johnson. I'll put the the link over the top of my head, so you can go quickly go over there so you can watch that. And we talked about Johnson & Johnson getting FDA approval, and by the time you actually watch this, they had already gotten authorization for emergency use, right? So again, so we'll have 3 candidates from a vaccine related standpoint out. So we're doing very well, right? So again, so that's our, I guess, our new news, especially for those who kind of stay to the end. Appreciate you guys, love you guys for that. Again, so we are Medicine Mondays, and now look forward to Friday live streams that happens at 9 p.m. Eastern time, especially by the time the kids should be asleep from that standpoint there. So you guys be blessed, have a great day, and I'm gonna see you guys next week.